Ask the patient to open their mouth slightly. Place the index finger between the chin and the lower lip while tapping with the hammer reflex the index finger. Repeat 2 or 3 times. The brisk contraction is expected. If not, there must be trigeminal neuralgia. The cranial nerve that controls this is in number 5. If possible, seat the patient to increase the possibility of the reflex exam. Support the patient's forearm by cradling it with yours or by placing it on the thigh. Identify the triceps tendon at its insertion on the olecranon, a discrete broad structure that can be palpated as it extends across the elbow to the body of the muscle, located on the back of the upper arm. Tap just above the insertion with the reflex exam. There should be movement on the muscle.
The forearm should be supported, either resisting of the patient. Things are resting on the forearm or of the examiner. The arm is midway between the reflection and extension. The patient sitting place a hand underneath the soles, dorsiflex the foot slightly. If the patient can sit laid down with their legs in the figure, identify the Achilles tendon, tone discrete cord-like structure running from the heel to the muscle of the calf. Position of the foot so that makes right angle with the rest of the leg. Use your hand is necessary. Then tap with the reflex hammer on in the Achilles tendon just above its insertion in the calcaneus.
Let the knee swing free by the side of the bed or have the patient laid down. Identify the patellar tendon, a thick, broad band of tissue extending down from the lower aspect of the patella, the kneecap, and place one hand on the quadriceps so you can feel its contraction. If the patient is in bed, slightly flex the knee by placing your forearm under both knees by contraction of the quadriceps with extension of the lower leg. If the reflex is hyperactive, there is some concomitant adduction of the ipsilateral thigh. Normal reflex would be the lower leg to extend to the knee level. Use the Jansik maneuver if there is no response. The patient's arm should be supported, resting on their lap. Identify the brachioradialis tendon at the wrist, approximately 10 centimeters above it. It inserts at the base of the styloid process of the radius, usually about 1 centimeter lateral to the radial artery. If in doubt, ask the patient to hold the arm as if in a sling. Flex at the elbow and halfway between pronation and supination. And then flex the forearm at the elbow again, resistant from you.
Middle finger straight by the top joint with one hand. Place one of their fingers on top of the nail on your middle finger. Flick the middle fingernail by quickly moving their finger down so that your nail and your doctor's nail make contact with each other. When your doctor performs the flicking motion, your fingertip is forced to quickly flex and relax. The palmamental reflex. Brush your thumb on the thinner from inside to the outside. A release twitch of the chin muscle is expected. Glabellar reflex. Make sure that the patient's forehead is clean. If not, then open the ways for it to do it. Instruct the patient to keep its eyes open. Tap several times with your index finger on the patient's forehead. It is expected that the patient does not blink.
It's a reflex that is normally seen in newborn babies who automatically turn their face toward the stimulus or make a sucking motions with the mouth when the neck or lip is touched. The reflex helps to ensure successful breastfeeding. The mandibular branch, or V3, supplies innervation to the mandible bone, region inferior to the nose. Babinski reflex is one of the normal reflexes in infants. Reflexes are responses that occur when the body receives a certain stimuli. The Babinski reflex occurs when the sole of the foot has been firmly stroked and the big toe moves upward or toward the surface of the foot and the other toe fans down. Using either the opposite end of a reflex hammer or thumbnail, the examiner uses his or her hand to scratch along the crest of the patient's tibia in a downward motion. It is controlled by the nerve roots L5 and L4.